There are a number of times that patients come to me requesting revision of previous breast surgery. Either they're looking for implant to be replaced, removed and replaced, maybe switching from saline to silicone, or they had a previous augmentation years ago, and for example, they are left with a little bit of asymmetry. Nipples are a little bit different in position, or the implant on one side may have migrated a little bit in terms of position, or maybe it was always a little bit asymmetric. It doesn't always mean the previous surgeon did a bad job or made a mistake. A lot of times it's just differences in the anatomy between the two sides, which are often very natural and exists in a lot of patients. What I tell patients is, if you can imagine that we all have some differences between our two sides, none of us are perfectly symmetrical. Imagine during surgery when we go inside and people are also different on the inside as well. And so that's one reason why a lot of times there can be small differences between the two sides. So asymmetry after prior surgery is another reason why, for example, patients would come to me for breast revision. And so I made this video really to talk a little bit about these things and what can be done. I'd say breast revision, by the nature of it, since it really encompasses a variety of different problems that need to be solved, it really encompasses sort of the broad range of plastic surgical skills that you develop during training and with experience. And what that is really is you're really tailoring that specific repair for what the patient needs. In some cases, like I said, the implant is slightly different in position, and so in those cases the revision would entail going in usually through the previous scar and developing the pocket, either lowering or raising the fold on one side to make it more symmetric, maybe changing the implant size or silicone versus saline. If it's an issue of nipple position, the nipples can be moved a little bit and the skin can be kind of tailored around it such that things can look more symmetric, more finished. Really varies based on that. So I'd say really best candidates for breast revision, again, are patients for whom they have very specific thing. They come to me saying, the implants are different or the nipples are different in position. Things look asymmetric for, ever since I had surgery or maybe just over the past year. And then so we can really tailor the repair specifically to that specific problem. Most revisions in terms of surgical time, again, it varies depending on what needs to be done, but I'd say most are done within an hour, hour and a half. Most breast revisions are quicker than the original breast augmentation procedure, and so they can be done really usually in a quite straightforward manner. Everyone's different. It really depends on the consultation. After surgery, as with most breast surgery, I have patients in a bunch of dressings, special surgical bra after the surgery as well, so that they don't need to take care of anything until I see them at the first post-operative visit. I take down the dressings, assess to make sure everything's healing well, and then kind of set them on their way. I usually like to follow patients a number of months after surgery to make sure things are healing correctly, make sure that the revision really works well. I'd say that for my breast revision patients, really that's worked well, probably up to I'll follow about 3 to 6 months after surgery, and just to make sure that there's no problems. Overall, I'd say that with very specific goals, the breast revision surgery can work quite well, and patients get very nice results.